So your period is heavy, but is it too heavy? How can you tell? In this week's episode, we take a look at what are the signs of heavy menstrual bleeding and what you can do about it. Hi, I'm Adrienne Irizarry. I'm an Eastern medicine practitioner who is passionate about women's health and helping women live their best lives. My goal is to put you in the driver's seat of your health, offering period solutions for a symptom-free life. Statements made in this program are for educational purposes only and not intended as a substitution for medical consultation or advice. We do not claim to diagnose, treat, or cure any diseases. This podcast is inclusive and welcomes all gender identities. The focus of the program is on biological function, and we will use the term women throughout, but it is referencing physiological and social challenges for biology, not identity. Come as you are, I am happy you're here and welcome all performances of identity. I hope you find something helpful in this show. Welcome back to another episode of the Reproductive Rebel podcast. I'm going to tackle a question that I get quite often, which is, how much is too much when it comes to heavy bleeding? So heavy is relative. When I'm talking to people in their cycle exams, a lot of times they're like, well, I had heavy bleeding. I'm like, okay, well, what did heavy look like? Some people will say heavy, and it means that it took the entire day to get through a pad. For others, heavy is a super plus tampon and a pad, and they're changing it every hour and they're still having accidents. That's a really big difference using the word heavy. So I thought that it would be really important to pull apart what it should look like and then how to know if you're dealing with too much. So let me first start by saying everything is relative. All right. When you're looking at your period, you're going to say light days, medium days, and heavy days in terms of your flow based on the relationship to one another. But not knowing what you're benchmarking against can really change the way that you report out that information to a practitioner, whether that's to your doctor or somebody like me. I can tell you from experience, I used to think, well, the heavy days I have now, again, perception, right? The heavy days that I have now were like medium days before I started doing the work that I've been doing to help bring my body into right relationship. So what I consider heavy now would have been like a walk in the park when I first started this work, because my heavy used to be so much heavier. And I remember when I was tracking my cycle, as my cycle kept getting healthier and healthier, I was like, oh, what do I call this? Is this a medium day or is this a light day? Because like this medium, I mean, I guess I could call it medium, but it's so much lighter than what medium used to be. And I found that as I went through this healing process that my perspective shifted. And what I considered cramping and discomfort was like so much more extreme. And so now when I get a little bit of a cramp because I've had a stressful month, I get a little dramatic and I'm like, oh, I'm dying, because my cramping experience used to be so much more severe. It used to take me out of my life. And I couldn't breathe. I couldn't go to work for several days. I never got to the point where I was throwing up, but I know that I had days where I seriously thought about it. So there is a, like, from your perspective aspect to the volume, okay, and how painful something is. Oftentimes, this is why when you go to the doctor, they're like, on a scale from 1 to 10, like, where is your pain level? Because our perception changes as our body shifts, right? Because something that used to be really, really bad, you might not be in that really, really bad, but it might feel bad compared to what you usually feel like now. Right? Because as your body heals, you're in a different place in your journey and your body expresses itself different. So just keep that in mind as you look at your own cycle. But I thought that it would be helpful to kind of give some general benchmarks of what could happen and what should happen so that you have an idea of whether your heavy flow is too heavy. I did a duet on TikTok a while back. And my heart totally broke for this woman, which is the whole reason why I highlighted her story as part of my duet, because she was talking about the fact that she would wear like a Super Plus tampon and she would wear a pad and she would sit on a Chucks pad and she would bleed through all of that. She couldn't go to work because she couldn't even move because she bled so heavy. That is too much. That will make you anemic. That is too much. So let's talk about what heavy bleeding looks like. Okay. So periods that last longer than 7 days. Now, you could go to something like Cleveland Clinic and ask, what are the signs of heavy menstrual bleeding, right? And they're going to tell you periods lasting longer than 7 days. Well, let's define that a little bit better. You should be experiencing red blood. No clots, no cramps, no funny business. Red blood for 4 to 5 days. Chinese medicine says 4 to 6 is normal. But really, the meat and potatoes of the whole thing is going to be 4 to 5 days. It should start light to medium, get heavier in the middle, come down day 3, 4, cruise to the finish line by 5. And if you have any red on day 6, it's like almost a non-event. That's what it should look like. A nice soft bell curve where it gets a little heavier in the middle and then it starts to come down and cruise to the finish line. It should be red the whole way through. So when I see definitions like periods lasting longer than 7 days, in my brain, this is red blood that stays consistently aggressive flow for 7 days or longer. When I have clients that come in and say they have 10-day periods, I ask them, are you red the entire way through? Because I used to think I had a 10-day period. Turns out I had a 5-day period and I had 5 days of brown that just wouldn't stop afterwards. And the brown was consistent and flow-like enough that I thought I was still bleeding. It was just brown. Brown blood is not period. Brown blood is not your period. Red blood, fresh red blood only is only what you can call a period. If you're getting any red to pink spotting before your flow actually picks up, that is not your period. The first day of fresh red flow that's actually committed, and you need to wear a liner or more to catch it because it's consistent and not just the pink stuff when you wipe, when you go to the bathroom and pee, but it doesn't like land in your underwear. That is not period. It has to be a committed flow. But there are women out there, and I highlight this because I've seen a lot of women who are like perimenopausal that come in with these kinds of heavy bleeding symptoms. So I think this is really important for you all to know. When you start your flow and it's like the faucet is broken open and nobody can find the emergency off switch, and it's like that for 3, 4, 5 days, that is heavy bleeding. You really should only get a day, maybe 2 if you've pushed it too much, of like the heaviest volume, but then it should come back down again. If you're passing blood clots that are a quarter size or bigger, this is a sign of blood stasis. It doesn't matter what color they are. If they are that size, we're dealing with some blood stasis, meaning that things are not moving along your interstate highways in meridians in your body the way that it should. If they are dark purple in color, that also tells us something about what's going on inside the uterus, and I won't bore you with all of that. If you want more information, feel free to reach out to me. But large blood clots are often accompanying heavy bleeding. And some of that is because the body goes, oh, I got to get this thing out. And it increases the flow in order to push that thing out. right? Some people, when I start working with them, I have them watch. Do you see an uptick in your flow and then you pass a clot? Or do you see an uptick in your cramping and then you pass a clot and then things back off a little bit? There usually is a correlation. So you're bleeding. If you're over 7 days, you've lost a lot of blood, my friend. If you're bleeding through one or more tampons or pads an hour for more than 2 consecutive hours, you are in a heavy bleeding experience. When that is happening for several days, or you are somebody, and I used to be one of these people, where you would stand up from your desk and you could feel it go whoosh, and like that sends you flying to a bathroom, a lot of times that is a heavy bleeding situation. That whoosh is coming because there's a lack of spleen chi energy. Okay, I'm using Eastern medicine terms here, so hang with me. But it means that there's an energy in your system that isn't strong enough. Usually there's worry that goes along with that. Or maybe there's a lot of cerebral work. Maybe you are a professor. Maybe you have a very intellectual job. Maybe you have been working on your master's degree. Maybe you are learning a new skill. Whatever it is, maybe you're planning to PCS somewhere. Can you tell that I'm a military family? And your family has to pack up and move across the country. Whatever that is, that kind of mental energy and exercise and use of that type of energy will oftentimes lead to lack of flow control issues. So it's like there's no regulatory control in the faucet. You just stand up and out it comes. You stand up from a lunch table at a lunch meeting or something, and you need to go to the bathroom, and as soon as you stand up, you know you've had an accident. I work with women like this all the time. You are not alone, my friend. If you're listening to this and going, "Oh crap, that's me." There are things that we can do about it. But like I said in the last episode, it just takes some time to get there. When you're at the point where you're having that kind of heavy flood bleeding, it is so tempting to do what the doctor suggests, which 9 times out of 10 is a hysterectomy. Sometimes they suggest an ablation. A lot of times they suggest a hysterectomy, and that can lead you down a whole bunch of twisty, windy roads too. Surgery is not going to fix this energetic deficiency in your body. It's just not. So if you're having that kind of flow bleeding, you had the organ taken out, you still are lacking spleen chi energy, things start to sink. Prolapse starts to come into the picture. Bladder prolapse is really common after women have had hysterectomies. And when they're having hysterectomies for this heavy bleeding kind of pattern, you're like setting yourself up very strongly for potential prolapse, which is really kind of scary if you think about it. So that's just something to keep in mind. When you're at that level of bleeding, you're worried about things like anemia, where you feel exhausted and tired, short of breath, brain foggy, because you've lost so much blood. So bleeding through one or more tampons or pads an hour for more than 2 consecutive hours, come see somebody like me. A lot of times you go to the doctor will suggest something like birth control, and that has a whole bunch of symptoms too. Just check out some of the other episodes that I've done on that. But when people use menstrual cups, I feel like those give you a much better read of what's going on inside your body in terms of flow. Pads are good too. I really don't feel like you get a good sense from a tampon. Here's why. The tampon acts like a plug that doesn't allow the lining inside of the uterus. The endometrial lining is being flushed, okay, because your period is a womb cleanse. It's supposed to be shedding the lining in order to clear the slate to start all new for the next month to prepare for a potential pregnancy, whether that's your goal or not. That's what your body's trying to do. So that flow, the blood, is actually the flushing mechanism to help push out this unused endometrial lining because the pregnancy didn't result. So when you use a tampon, it is a plug product. It blocks the exit outside of the cervix. So it absorbs the blood, which is the flushing mechanism, but it's not allowing the blood to flush out what it's supposed to flush out. And so that backs up. and creates problems. So when people are experiencing really, really bad cramping, one of the first things I tell them is go without a tampon. And usually that creates mass panic and wide eyes. And they're like, my period's too heavy for that. I can't do that. But then when they do, they go, oh, my period was lighter this month. It's like, well, no, actually, you're just not working as hard to push out what is supposed to be flushed out. So it doesn't feel like it has to turn up the faucet quite as hard because the body is able to more gently process out what it's trying to push out. So this is why I like menstrual cups, honestly, when you're in a heavy bleeding situation like this, because not only will it allow you 30 milliliters of fluid before that sucker starts to overflow, which is way more than a tampon, but it acts like a catcher's mitt and it catches the lining. So the body doesn't have to work quite as hard to flush. So if you're looking for leak-free protection, that is where I would highly recommend going. There is less bacterial risk for infection. So TSS goes out the window because you're dealing with medical grade silicone. Like it's just a totally different ballgame. But the cup will give you a much better idea of how much fluid you're losing because it has like measurement lines on it. And it like the top line is 30 ml. Like you can see I've lost 30 milliliters of fluid. Not all of it is blood because you really shouldn't be losing more than 2 to 3 tablespoons of blood, like actual blood, through your entire bleed. But there are other fluids mixed in with it, right? So sometimes you'll notice like your blood is kind of stringy and it has like a mucousy quality to it, right? So like some of this is where it gets some of the extra oomph, we'll say. Although the mucus tells a story about what's going on also. So losing more than 80 milliliters of blood during your period is a sign of heavy bleeding. Okay, so we're going to talk about the cup. So your period should really be 35 to 40 milliliters. All right. So maybe you have a heavy day where you empty your cup once and then it's not quite as aggressive the second heavier, and I'm using air quotes, heavier day. So this is why I'm saying like we're looking for a soft bell curve, folks. It's lighter, it gets a little heavier in the middle, it comes down drastically once you get past the heaviest part in the middle, which for most people is like day 2. Some people it's day 3, but usually there's one day that it's a little bit on the heavier side. You're going to feel a little more tired. You're going to want to move a little bit slower, and that's okay. If you honor that your body is asking you to slow down on that day, the flow will drop off drastically like it's supposed to. I can tell in my own body now when I've done too much because it will be heavier on day 3 rather than medium light on day 3, with my heavy day being day 2. Like this past month, for example, I was heavy on day 2 and day 3, but I did an event in the middle there. It was something I was already committed to long before, and I try really hard to plan my life around my cycle so that I'm not overdoing it too often, but this was something that I was committed to, and I didn't have a choice. I had to do it because that's when it was scheduled a year ago. And when I realized that my cycle was going to line up with it, I was like, oh man, this is going to be a heavier month. And sure enough, it was. And you do feel tired and you get winded a little more easily. And being able to care for yourself during that heavier day helps the heaviness to drop off. So, like in that example of the lady I talked about previously who had super heavy bleeding, she never knew when the end of her cycle was and called me earlier this year and was like, I had my first 28-day cycle, Adrian. Like, oh, hey, we did it. She was bleeding pretty much all month and she had days at a time where she was bleeding like a full menstrual cup every day kind of thing, which is a lot of blood loss. And she was really tired as a result. And it takes time to kind of rebuild through that. But you also have to slow down through that. Because think about it. This is kind of like when you cut your arm and you're still trying to like move around, or you're still exercising, or maybe I'm going to give you an illustration. So let's say you're moving furniture and you catch yourself on the corner of a dresser and you have cut your arm and it is bleeding. You put pressure on it, you get it to stop, or you think you get it stopped. And then you go and help lift the dresser because you're not bleeding all over the place. But by the time you get the dresser into position, you look at your arm again and you go, oh, I didn't get the bleeding stopped. It's still bleeding. Why? Your heart is pumping harder. You are going to bleed. You're going to bleed harder because your heart is pumping from exertion. It's the same thing with your period. If you are exerting yourself too much, and that can be mental work too. If you are exerting yourself too much when you are on your heaviest bleeding day, you're going to bleed harder, and you don't want that. So if you can slow down during your bleeding days, go back to the episode where I talk about period care. I cannot emphasize enough, period care is critically important. I have a mini course in the Tao of Women Institute on my website that walks you through proper period care. It's really inexpensive. It's short, sweet, and to the point. The whole goal is to get this information out to you so that you know how to take care of your period in a meaningful way. Because when you're pacing yourself and you're slowing down and you're keeping your body warm and you're trying to proactively plan with a mind's eye around, I'm going to be bleeding, exertion will make me bleed more, your experience with heavy bleeding will begin to decrease. Yes, there are also some things we need to strengthen your body so that your body has the energy and the tools it needs to regain control over that flow. So yes, there is some work to do there, but slowing down in proper period care, I've had clients be like, Adrian, just taking care of my period because I haven't even been able to start with the things that you told me to. Just taking care of myself during my period made a huge difference. Yes. There's a reason why we used to have red tents. We are supposed to slow down while we're bleeding. We don't. And in a lot of cases, we can't because of the lifestyle that we live. But this is where I invite you to rethink your priorities. Because if you're bleeding like that and you're bleeding that hard and you have clots that are that big, your body's working really, really hard to try to keep you alive, to try to support you, and then you're still exerting yourself when the body is working really hard to try to help you. So take a look at that period care course. Take a look at the episode that I did earlier this year about period care and menstruation matters, because small lifestyle changes like slowing the pace of your life down for a couple of days during your heaviest days will help your period not be so heavy overall and will help get it to stop faster so that you're not experiencing abdominal pain. You're not bleeding like red blood bleeding for 7 days or longer. You're not passing quarter size or larger clots. You're not bleeding through one or more tampons or pads an hour for 2 consecutive hours or more. Because when you lose fluids that fast and that hard, you're probably also not replenishing them equally as fast, because there's a reason you're exerting yourself, and not replenishing puts you into a deficit. When you get to perimenopause, those deficits show up in capital letters. The way that we abuse our bodies as we go through these phases of our life shows up in all caps and literally is yelling at us by the time we hit perimenopause. And then we are incredibly symptomatic and we are miserable and we don't understand why we're so miserable. And we're like, well, my period was bad, but not this bad. And I can't live like this. And so we get the hysterectomy or we get the ablation. And then there are complications from those things. It is completely possible to regain control of the wheel of this car, to slow the bleeding down, to get it into this 4 to 5 days of fresh red blood only. It is a process to do it. But if you're willing to stay the course with the process and give it some time, you will heal. However long this has been spinning out of control will kind of call the shots in terms of how long this process may potentially be. Your dedication to the process will also factor into how long this process may potentially be. However, it is doable. The woman that I referred to earlier who called me about her 28-day cycle, the first one she had had in years, was in her perimenopausal years. It is possible. So don't feel like the sins of the past cannot be healed and addressed now. They can be, but it is not a quick fix. Heavy bleeding is like pushing a big boulder down the hill. The more it goes, the further down it goes, the faster it goes, and it continues to pick up speed. And you get to a really scary place really fast. It doesn't have to be that way. There are ways to deal with it. There are holistic, natural interventions that can be done outside of taking the birth control pill and surgeries. There is options in that middle area there. The question is whether you're willing to step into the process and do the work in order to have the outcome that you want. Because the quick fix has some really potentially detrimental to your quality of life kinds of side effects, like bladder prolapse and needing to have a suspension put in to keep you from leaking. That's a very real problem. And as a 40-something, I don't know about you, but I want to be able to walk to my mailbox and back. I want to go for a run and not worry about full bladder wetting myself. These are problems that I see every day with clients who have experienced buyer's remorse because they were so desperate for a solution that they went under the knife and they had the surgery, and now they have problems controlling their bladder. That creates intimacy issues because they have no control over their bladder. It creates issues with bowel function, or it can, because the rectum can prolapse. It creates hot flashes and night sweats that the body may not have ever had to tangle with. And this is even leaving ovaries in, folks. So if you are starting to think about options like this, make sure you talk through all the potential repercussions with your practitioner. Maybe get a second opinion from another practitioner, because there are ways to heal, but it is a process. So you have to be willing to go the distance and do the journey. But heavy bleeding like this is heavy. This is really, really heavy. This is anemia level heavy, folks. It shouldn't be that heavy. And it's possible for it not to be with a little bit of holistic wellness work. Thank you for joining me for another episode of Reproductive Rebel. Reproductive Rebel is recorded by certified peri-steam hydrotherapist and acutonics practitioner, herbalist, and Chinese nutritional therapist, Adrienne Irizarry of Moon Essence LLC. If you are interested in setting up an appointment for one-on-one support, ordering from our store, or checking out our course offerings, visit our website at moonessence.life. Be sure to subscribe to our newsletter and get insider information on upcoming events and offerings. Join the conversation. Like and follow us at Moon Essence Me on Instagram, Facebook, or LinkedIn. Your voices make this program possible. Thank you all for your continued support.